Welcome to the Healthy Heart Ambassador Blood Pressure Self-Monitoring Program Nutrition Education Seminar on reducing sodium intake. This seminar is part of our commitment to helping you effectively manage your blood pressure. Today, we'll cover an overview of nutrition and blood pressure facts, what sodium is, strategies for reducing sodium, low-sodium meal options, choosing healthier alternatives, and why a low-sodium lifestyle is effective. Let's begin by discussing nutrition and blood pressure. The choices you make regarding your diet have a direct impact on your blood pressure management. The general recommendation is to consume less than 2,300 milligrams of sodium per day, or less than 1,500 milligrams for special populations at risk. 9 out of 10 Americans consume more than the recommended amount. Excess sodium causes the body to retain fluid, which can stress the heart and make blood pressure management more difficult. Individuals most concerned about sodium intake are those at risk for heart disease, including people over 51, African Americans, and those with hypertension, diabetes, or chronic kidney disease. This group accounts for about half of the U.S. population. Maintaining healthy habits is important for everyone to promote health. Now, let's explore practical ways to achieve a reduced sodium intake. Sodium is a mineral vital for fluid maintenance, nerve impulses, and muscle function. However, the body only needs about 500 milligrams to function properly. Common table salt is sodium chloride, and 90% of American sodium intake comes from it. Consuming too much sodium leads to excess sodium in the bloodstream, which pulls in excess fluid. This increases the total blood volume and the amount of blood flowing through your body, causing blood pressure to rise. 1 teaspoon of salt is equal to 2,300 milligrams of sodium, which is the maximum daily recommendation for the general population. If you are aiming for less than 1,500 milligrams, you should consume less than 3/4 of a teaspoon of salt per day. More than 75% of the sodium we consume comes from processed foods, such as bread, condiments, cheeses, and processed meats. Other sources include adding salt to foods and naturally occurring sodium in some foods. To reduce sodium intake, eat more fruits and vegetables. Use fresh poultry and lean meats instead of processed options. Limit sauces and instant products, and use spices for flavor. When dining out, ask for no salt, and always read nutrition labels to select the lowest sodium choices. When reading labels, look for sodium-free, meaning less than 5 milligrams per serving. Very low sodium is 35 milligrams or less, and low sodium is 140 milligrams or less per serving. Reduced sodium means at least 25% less sodium than usual. Preparing your own meals is a great way to control sodium. Sample low-sodium meals include whole wheat toast with no salt-added peanut butter for breakfast, a quinoa salad with rinsed black beans for lunch, and grilled chicken seasoned with rosemary and lemon for dinner. When choosing healthier foods, consider the sodium content of each ingredient. For example, a yogurt-based breakfast is generally lower in sodium than a breakfast sandwich with cheese and turkey bacon. Always look for ways to reduce sodium, such as eliminating high-sodium condiments or cheese. Reducing sodium works by helping you establish healthy habits, promote health, and prevent chronic disease. It also helps reduce fluid retention, which aids in weight and blood pressure management. Ultimately, you will feel better and find it easier to manage your blood pressure. Now, let's move into a discussion about what you have learned and how you can apply these tips to your daily life. Think about your food choices and how you can reduce sodium intake, such as changing some choices throughout the day. Consider how you feel after eating salty foods. Finally, think about how to use labels to ensure you're not consuming too much sodium. We will now transition to the role of physical activity in blood pressure management, an important component of a healthy lifestyle. Regular physical activity can significantly reduce blood pressure and other cardiovascular risks. Moderate physical activity is also known to help reduce blood pressure in less responsive hypertensive patients. Aim for 30 minutes of brisk walking or equivalent physical activity 6 to 7 days a week for better blood pressure management. These claims about physical activity and blood pressure management are supported by several resources and clinical trials. Thank you for joining this video. Remember your key takeaways and the changes you will make to reduce sodium in your diet and incorporate more physical activity.